never wants to get the flu. You can have fever. The fever usually is between 100 and 140 degrees. Coughing, congestion, sore throat, runny nose, fatigue, headache, just a general feeling of not feeling well at all. Most people think, oh, I might have a cold, but usually the flu is more severe than the cold. A cold, you might have a low grade temperature, not a high temperature. And with the flu, you're going to have headaches. You're going to feel lethargic and fatigue. The flu symptoms usually last not longer than a week. We advise patients who have the flu longer than a week to definitely seek medical attention. The best way to prevent the flu is to get the flu vaccine, and yes, the flu vaccine is safe, so you don't have to worry about that. Here at the University Park Health Center, we do have flu vaccine available, and we had that vaccine available as early October. So we welcome everyone. If you have a pulse, you need to get the flu vaccine. All you have to do is come in to the first floor in the immunization clinic and ask for the flu vaccine. There's no special order for it. You just have to let them know if you have any medical problems. The flu vaccine takes 2 weeks to work because we can build antibodies after 2 weeks of taking the flu vaccine. So it's very important that when it's available that we get it, because we do not want to wait until there's a pandemic, epidemic. Flu season is usually in the fall, winter, and early spring. People are susceptible to the flu during this season because it is usually a time where the environment is very favorable for the flu virus to replicate. So it's very important during these times to make sure that we clean after ourselves and to wash our hands and to use the antibacterial sanitizers and things of that nature. Most people don't know they have it until a day later when they become symptomatic. So they were probably at a party or going to class or in your dorm the day before, and they did shed that virus. Remember, the influenza virus is spread by droplets. So if you're sneezing, coughing, you can spread the virus around. So we really want people to cough in their sleeve, their elbow, to cover their nose, and then throw away your tissue so that other people won't have to pick it up and be exposed to that virus. If you have the flu, you need to stay home for at least 5 to 7 days because you're shedding the virus for 5 to 7 days after you become symptomatic. However, with that being said, call our advice nurse. Make sure that you are not developing a complication of the flu. Secondly, we would tell that student after calling the advice nurse to make sure that they treat themselves well, to get hydrated, never take aspirin, because aspirin can cause Reye syndrome and a viral infection. You can take Motrin. If you have a severe headache, if your fever is high, you would need to at least come and get a quick evaluation here because we would not want a complication to develop and not help you.